In the opinion of the chair, the ayes have it. The amendment is agreed to. It is now in order to consider amendment number 103, printed in Part B of House Report 118-272. For what purpose does the gentlewoman from Georgia seek recognition?
Mrs. Chair, I have an amendment at the desk.
The clerk would designate the amendment.
Amendment number 103, printed in Part B of House Report number 118-272, offered by Ms. Greene of Georgia.
Pursuant to House Resolution 864, the gentlewoman from Georgia, Ms. Greene, and a member opposed, each will control 5 minutes. The chair now recognizes the gentlewoman from Georgia.
Thank you, Mrs. Chair. My amendment uses the Holman Rule to castrate the salary of Assistant Secretary of Health Richard Levine to $1, the same way he supports castrating children who suffer from gender dysphoria. Richard Levine was a diversity hire by the Biden administration to push the demonic gender-affirming care agenda, and he is unfit to serve as the HHS Assistant Secretary for Health. He should never have been hired after he, serving as Pennsylvania's health secretary, directed nursing homes and care facilities to take in COVID patients while simultaneously pulling his mother out of her own care facility. Dr. Levine has spent his career focusing on treating, let's say, grooming children, adolescents, and young adults. He now serves as a top advisor for our nation's health policy while masquerading as a woman. A mentally ill man who thinks he's a woman should never be responsible for overseeing anything in the Department of Health and Human Services, let alone the Office of Women's Health. This same man who is empowering kids to mutilate and castrate themselves under the guise of so-called gender-affirming care said that he was happy to have waited to transition genders so that he could have kids. Oh, what a complete hypocrisy. He has promised that mutilating and castrating kids will soon be normalized and that it has the highest support of the Biden administration. He has stated that sex reassignment surgery and puberty blockers for kids are life-saving, medically necessary, age-appropriate, and a critical tool. He also said there shouldn't be state laws and actions that dictate principles of transgender medical care by us pediatric experts, illustrating why we need federal protections like my bill, the Protect Children's Innocence Act, for our most vulnerable and innocent children. It is our job to protect our children from sexual groomers like Levine, and reducing his salary to $1 is a strong first step. He has infiltrated our Department of Health and Human Services with guidance and curricula that further his perverted agenda. The Office of Population Affairs, which is directly overseen by Levine, put out guidelines encouraging our youth to seek gender-affirming care. These guidelines discussed how and why our youth should seek puberty blockers, as well as top and bottom reassignment surgeries. Let's be real, that's cutting off their body parts before they're adults. Our initiatives and guidance he has issued include a cultural competency curricula. This cultural competency curricula is for behavioral health and primary care practitioners to assess, treat, and refer LGBTQ clients in a culturally appropriate manner. Part of his curricula is for nurses to focus on teaching cultural competency in the care of LGBTQ older adults. Another part of this curricula includes utilizing the National LGBT Health Education Center for its educational programs on how to best meet the learning styles, needs, and time constraints of LGBTQ people. And last, additional part of this cultural competency curricula includes a training specifically designed to help both administrators and clinicians address the various aspects of providing effective substance abuse treatment to LGBTQ people. Obviously, they shouldn't be cutting off their body parts as children. The training covers such topics as legal issues, the coming out process as it relates to behavioral health, how to make a provider organization more LGBT welcoming, and more. Another agenda Levine has been pushing for is the vaccination of children. Just recently, he was calling on parents to speak up and defend vaccine requirements at schools, saying they need to be part of back-to-school checklist of an emergency use vaccine that children do not even need. Our mentally ill Assistant Secretary for Health is more concerned with woke gender and vaccine agendas than serving the everyday health and needs of the American people. He deserves to be fired immediately. This man is a danger to all children and should not be serving in our government. Mrs. Chair, I urge all of my colleagues to vote yes to my amendment, and I reserve my time.
The gentlelady's time has expired. For what purpose does the gentlelady from Connecticut seek recognition?
Madam Chair, I claim the time in opposition.
You're recognized.
Thank you. I rise in strong opposition to this amendment. Public servants should be commended and not demonized. Our federal government needs talented, intelligent, hardworking people who are willing to bring their skills, their expertise, their compassion, their experience to public service. Proposing to eliminate the salaries of hardworking public servants is petty and is beneath the dignity of this body and is not how we should solve differences of opinion on policy. Admiral Levine, I repeat, Admiral Levine is the head of the United States Public Health Service Commissioned Corps. That is one of the 8 uniformed services in the United States. A physician. She completed her training in pediatrics and adolescent health at the Mount Sinai Medical Center in New York City. The focus of her medical career has been the intersection between mental and physical health, particularly for children and for adolescents. Imagine the knowledge, the expertise, the study, the commitment of Admiral Levine. And given the ongoing mental health crisis in this country, particularly with children and with adolescents, I am grateful and in awe of her expertise and of her service. And prior to joining the Biden administration, Admiral Levine served as Pennsylvania's Physician General and Secretary of Health. My God. What a background. She is highly qualified for her position, and I want to tell her tonight that I commend her efforts to improve the health of Americans across this country. But let's be honest, the Congresswoman from Georgia submitted this amendment to target the salary of a transgender health official. It is as simple as that. It is ugly, it is disgraceful, and I ask whomever is watching and the American people and everyone in this body to note the date and the time when the Republicans in the House of Representatives have hit a new low. I urge my colleagues to vote no on this vindictive amendment offered to target the salary of a qualified transgender health official who has the expertise and the knowledge to address health issues in a way that many in this body are unable to do. I urge my colleagues vote no on this amendment, and I reserve the balance of my time.
The gentlelady has only time remaining.
I yield back the balance of my time.
Gentlelady yields. Now the question is on the amendment offered by a gentlelady from Georgia. Those in favor say aye. Aye. Those opposed say no. No. In the opinion of the chair, the ayes have it. The amendment is agreed to.
Madam Chair.
For what purpose?
I demand a recorded vote.
All right. Pursuant to Clause 6 of Rule 18, further proceedings and the amendment offered by the gentlelady from Georgia will be postponed. It is now in order to consider amendment number 104, printed in Part B of House Report 118-272. For